Welcome to The Bridge, Your Health, Your Voice, the official podcast to the University of Maryland, Baltimore School of Pharmacy Patients Program. The Patients Program is the bridge between the community and researchers. This partnership is created to help researchers listen to the community's voice in order to build a bridge to an effective learning healthcare community.
Welcome to The Bridge. My name is Paris Barnes, and I'm your host today. 2025 has truly been a year to remember. We've navigated big pivots, celebrated incredible growth, and welcomed inspiring guests who shared their wisdom. And perhaps the most exciting part, we hit a major milestone that we couldn't reach without you. Today, we're taking a moment to reflect on the journey, celebrate the wins, and share what's next. So settle in, and let's dive into this special episode together. We're going to have a fireside chat. Our most popular episode was Hidden Heroes in Clinical Trials, featuring industry leaders Edie Edens, Casey Jackson, and Aaron Knight.
And with clinical research is how highly regulated that we are and how so much patient protection is out there just for clinical research.
Employers need to realize that there are so many transferable skills out there that can support the clinical research industry and just human subjects research industry. It doesn't even have to be clinical research.
Pandemic was a heck of a time for any and all involved. What I'm saying is when you already have individuals who don't understand all of what we've just said, and then they see things moving quickly, and they see potentially some things failing while other things succeed, which means guidance is getting changed constantly on them, it shook out a fear in people.
We also launched our Going National initiative, highlighting sponsor voices like Chris Blanchett of Novo Nordisk and Deepa Lalla from AstraZeneca.
How does the work at AstraZeneca ensure that health equity is truly embedded in their work rather than just a buzzword?
One of the reasons I love working here, I've been here 2.5 years, is because our company and our senior leadership really walks the walk on health equity in ensuring that it's not just patients enrolled in our trial. Every patient should have access to a trial, regardless of where we're coming from or your socioeconomic status and anything else, but also doing things to ensure that we can have patients who may not otherwise have access. It's not just our treatments, it's the entire spectrum of care that we're focused on and in an appropriate fashion, right, within the guardrails that we have. But what can we do to help inform and ensure that patients are getting the right treatment, no matter their zip code or socioeconomic status or ethnicity?
I think the program and what you guys are doing there in Baltimore is tremendous, and it's tremendous in a way that it's helping to change healthcare. It's helping to change research. It's helping to change how pharmaceutical companies think about the patient. And I think now what we need is, more diversity. We need to look at other communities, other, parts of the country so that we can then, interject that perspective as well. So I'm super excited about it going national and seeing this cascade across the nation and gaining more insights and learning and, continuing to develop and evolve to make sure that we're helping patients.
As well as 5 other incredible partners. We're thrilled to welcome our new national community partners, amazing leaders and organizations who share our vision of community-driven health. Trevor and Shantae Jackson, founders of the Sandal Blue Foundation.
There was this moment that we were both in our own hospital beds, and we just felt like we've got to do something to help other people.
I think that's why we're so passionate about this, is because of the care that we got.
One of the ways that we help people is through patient advocacy and letting patient voices be heard and allowing other people to understand where the patients are coming from.
Zelena Watkins, founder of the Women's Wellness Lounge.
There was a thread in the community of women of color who I felt voices weren't being heard, and I saw them really seeking care for the exact same reasons all the time.
Anna and Jordan Rothkopf, dedicated advocates and storytellers.
I love that you're empowering people, and that's very important because as a patient, you feel like the power is taken away from you.
Bring together people with lived experience of disease, but who believe and understand in the power of art as a tool for healing, also for bringing communities together.
Brian Gutierrez, championing health equity in underserved areas and a champion for the disability community.
I remember a time when I was very young, around the age of 12 or 10 years of age, when my mom was managed by healthcare. The experiences that my mom went through really motivated me to advocate for my medical needs and encouraged me to understand more about my disability, as I'm still learning about spinal bifida every single day.
And Sharon Rivera Sanchez, founder of Trials of Color.
Going national can really bridge that gap where we bring in researchers as well as patients together. I believe our collaboration can serve as a model, engaging more community from all walks of life.
These partners are not just joining the initiative, they're shaping it. Each brings unique expertise, a deep connection to their community, and a commitment to co-creating better health outcomes for all. And of course, none of this will be possible without the generous support of our sponsors, Bayer, AstraZeneca, and Novo Nordisk. Their commitment to patient-centered research is helping us bridge the gap between science and the lived experiences of communities across the nation. This year, we also mark the kickoff of Year 4 of the Patients Professors Academy. We welcome Joe Howarth, lead training specialist for the program, along with 2024 graduate Chisa Nosamiafan.
PPA is amazing because we have one goal and everybody's saying, how can I get there? You know, which path do I take? Because I've taken what I've learned here, I've taken what I've understood about other people, and I've taken it back to my work and to my communities and to the projects that I have going on.
Making sure that patients not only have a seat at the table, they have a voice, and then that voice is listened to, it is heard, and it is, it impacts how research is done, how it's conducted, how it's planned, that you are forming long-term partnerships with patients and communities so that the research continues to evolve, continues to really match what the priorities of the community are.
And one of our proudest moments, celebrating the 3rd anniversary of the Bridge podcast with special tributes from some of our former guests.
Happy birthday to the Bridge podcast. What an incredible accomplishment. We're so grateful for all of you here listening and being able to enjoy 3 full years of wonderful content. Congratulations.
Yay to the Bridge. It's your 3rd birthday. Congratulations and cheers to more years of doing good.
Hey there, Edie Edens and Casey Jackson. Happy anniversary to the Bridge podcast. We just want to say it has been amazing to be a part of your Hidden Heroes. Thank you for having us and keep up the good work.
Wishing the Bridge podcast happy anniversary! Happy birthday, 3 beautiful years.
As we wrap up 2025, we just want to take a moment to say thank you to all of our incredible guests, our amazing partners, and especially you, our listeners. Your support and engagement and your encouragement have been the fuel behind this journey. You inspire us every day to keep building bridges between research and community. And the best part, we're just getting started. We can't wait to bring you even more conversation, insight, and stories in 2026. Here's to another year of learning, connecting, and growing together.
Thank you for listening to the Bridge podcast. To learn more about the Patients Program, visit our website at www.patients.umaryland.edu.